Good morning. Welcome. My name is Scott Quimby from Computer Systems Integrators, CSI. Welcome to our HIPAA seminar this morning. Protect yourself, protect your patients. CSI has been around since 1991, and I personally have been working with integrating technology solutions and businesses and public sector and the likes for 34 years. We're going to cover a bunch of information this morning. Hope you find it useful, so we're just going to start. Basically, we're going to talk about the HIPAA Omnibus Rule, which was revised in 2013. The rule went into effect in March, and the penalties and enforcement went into effect in September. Basically, we're going to talk about the technology aspects to this. There's a whole lot of aspects to HIPAA, and you guys have been dealing with HIPAA for a long time on the confidentiality side and all that. We're not going to try to get in the middle of that. We're not lawyers. This isn't legal advice. This is just our experience and our thoughts as to what's going on and how to proceed. So, diving in. Covered entity, that's you guys. In the HIPAA framework, what's happened after September that's kind of changed the dimensions of this is enforcement now has teeth through the Office of Civil Rights, OCR. And they're doing audits and they're doing fines for people who are found to not be complying with these new requirements relating to technology. One of the main capstones of this is that all vendors coming in contact with ePHI, Electronic Personal Healthcare Information, need to have a business associate agreement, and they need to be HIPAA compliant, right? So it's basically not only just signing a piece of paper, but they need to be HIPAA compliant. And you actually have to go one better, is the fact that if they're doing using services to perform the services for you that comes in contact with your ePHI, those vendors that they use, that we use, for instance, have to be have business associate agreements and be HIPAA compliant as well. The rules talk about required controls. Those are things you must do versus addressable controls, which are things you should do. And I give you the direct link from HHS that defines both of those so you can see exactly what they wrote. One of the big things about the new changes is documentation. Document, document, document. What is your process? How do you do things? How do you know what you know? If something bad happens, what are you going to do about it? What is your process? Now, people say, oh, I don't care about this stuff, but here's an example from HHS in terms of enforcement fines. An office lost a flash drive, a USB stick, lost a laptop, lost a hard drive. There's some big numbers there, and that's what this is really about, is talking about how to keep you guys safe from that. Electronic Protected Healthcare Information, ePHI. These are kind of the capstone principles of what's going on. Ensure the confidentiality, the integrity, and the availability of all ePHI, PHI. Now, a lot of people get hung up on what we've been doing forever, which is the confidentiality. I go to my doctor, they make me sign a HIPAA waiver form, all that. But there's a lot of emphasis also now placed on the last two words, integrity and availability. All right, integrity is whatever you're doing in terms of servers and computers and internet and all that. Will it hold up? Does it have redundancy? Will it be there this afternoon, tomorrow? Will the data be there, not corrupted? Will you be able to get at it? Availability is it available? If I come in today and say, I need a copy of my records because I'm going to the city to go see some specialist. Are you going to be able to produce that in a reasonable period of time? If something really bad happened to you today with your servers and with your equipment, how long will it take you to be able to get my records back to me? That's what they're really after. Protect against reasonably anticipated threats to the security and integrity of information. Reasonably anticipated threats. There are hackers out there, identity theft, trying to steal your information. That's a reasonably anticipated threat. There's viruses out there trying to do bad things to you. That's a reasonably anticipated threat. Protect against reasonably anticipated impermissible uses or disclosure. So you turn around and you say, I wish to give people access to this information. Well, you're going to give people access to this information that needs this information. It's not reasonable to say that the custodial staff needs to have this information. It's not reasonable to store patient records sitting out where patients just wander through unsupervised. Reasonably anticipated is the word. All right. Why is this such a big deal now? Well, they're estimating that $50 per medical record is what it is going for on the black market. So every one of your records is worth $50 for medical fraud, identity theft. Dell SecureWorks, which is a big security firm doing giant $50,000 engagements with substantial healthcare providers. I read something from them a couple months ago that they said if somebody can actually piece together a digital person, have enough information between medical records, Social Security, birth information, and the like to create a electronic person out of that, that could be worth as much as $1,200 on the black market per person. So this is a huge, huge business. And why do we care? This is just February 26th. The RSA is one of the premier security trade shows in the computer industry. And here's the Computer World headline. Huge turnout at RSA shows hackers are winning. High number of attendees and exhibitors are indication of troubled times. You heard about the Target thing back at Thanksgiving. All right, that's what this is about, right? These people are out there. They're looking to steal your financial data. They're looking to steal your patient data. They're looking for this identity theft stuff to be able to get money, basically. Now, here's one off the bat that if you're doing this, when you hang up from me, you're going to run, not walk, and you're going to figure out how to fix it. Windows XP, which has been around forever, it's rock solid, it's wonderful. Why fix what isn't broken? Well, Microsoft, in their infinite wisdom, has decided that on April 8th of this year, just a couple days over a month from now, that it's gone, that there's no more security updates, there's no more patches, hot fixes. If something bad happens, they will not pick up the phone. You in the healthcare industry, if you have Windows XP touching any of your financial systems, any of your patient management systems, you are at extreme risk. And if something bad happens, this is going to be held against you in terms of liability and an audit. All right. The estimated of these exploits, you always hear about hackers getting into stuff like the Target thing that I mentioned, and the estimated street price for an exploit to break into, say, Windows XP or what have you, they estimate it's about $50,000 on the black market. but they said that the exploits against Windows XP after April 8th is between $100,000 and $150,000 is what they think they're going to go for. Why? Because Microsoft isn't going to fix them, and there is going to be no defense. So again, if you have Windows XP in your network, in your practice, touching your data, financial or patient, after April 8th, you are really exposing yourself not only to something bad happening in your practice, but if something bad happened, knowing that you did not address this and retire this by that time, you would probably face some serious scrutiny and financial implications. So you really have to make sure that there isn't a speck of this in your world after April 8th. All right, now one of the problems with HIPAA, it's prescriptive. It tells you what you should do. You should have good security. But it's not descriptive. It doesn't tell you how to do it. You should just do it. Well, how should I do it? Well, you should just do it. That's the frustration, and we're going to try to at least help you with some of that. There's a couple things. There's physical controls, physical access to your equipment. Administrative controls, that's process, that's documentation, that's procedures. And there's technical controls. How do you manage updates? How do you manage patches? How do you know that your antivirus is good? How do you know your firewall is good? The capstone gold standard document that is the basis for all these new regulations from HHS is the National Institute of Standards 800/30 document. That's kind of the basis for this. So if you want to go read the source reference material that's behind all this, it's National Institutes of Standards 800-30 is a good place to start. Physical controls, protecting your client data from physical intrusion. Simple stuff. Do you have your servers, your switches, your file cabinets, all your materials, your backup tapes, whatever you're doing? Is it away from unauthorized access? Is it behind locked doors? Can I just wander in? We go to some of these medical practices, and the stuff is just hanging out there that anybody can walk up to. The door is unlocked. It's not a good scene. This is really basic stuff. Physical controls, badge access, you swipe yourself in. Surveillance cameras, you're monitoring who's going in and out. For the bigger sites like hospitals, the giant data centers, those things, fingerprint, biometric scanners, lobby security. Can I just wander through your offices unchallenged, or do I have to go to the front desk and wait to be called in or buzzed in or what have you? Bigger sites, facility security plan. How do we keep people that shouldn't be in sensitive areas of the building with sensitive data away from those areas? Contingency plans, disaster recovery. This is backups. Do you do backups? Do you test the backups? Do you do test restores to know that your backups are any good? Backup tapes and backup media are supplies. Are you buying that every year? Running those restores to prove that they're any good? Do you do off-site backups, whether that's if you're multi-site, take backups and Pony Express them to another building in case something happens to that building, or are you backing up to the cloud, to the internet, as if the building gets compromised? Redundancy, so you're not down. Now have you invested enough in your infrastructure, in your servers, in your switches, and the like, that you can survive certain types of events? We were talking to somebody the other day, and they had redundant firewalls, and they had pretty nice setup on paper, but they didn't base it on enterprise class equipment, and they had a big problem, that they had a problem off hours and the vendor really didn't want to talk to them, and they suffered quite a bit of downtime to get themselves back. That's a big deal, is do we have the redundancy in there? If you lose a hard drive, will your server still run? How do you know you even lost a hard drive to know that you should replace it? Then, because the object really is not to be down. You may be annoyed, but we want you to be annoyed and alive and not down. And then there's a whole generation of equipment now in they call it the business continuity space, or BDR space, where it's essentially standby servers, so that the server did die, that one of those things was so profound that you couldn't survive it. Well, this other server will just take over for it and keep going in your office. Or what if the building's not viable? A flood, a fire, a natural disaster. We've had all these snow roof building collapses. Can you all go down to the Hampton Inn and in 2 hours have a virtual office, run down to Best Buy and buy a couple laptops and have a secure virtual office in 2 hours, having full access to your equipment? We know how to do things like that. The question that HIPAA is going to ask you is how long to access client data from an event. So if something bad happens to that server and I walk in and say I need my data, how long? We had a case the other day. We were in an office. They had an EMR system. The server died. I think there had been 6 or 8 weeks waiting to get their data back. It's absolutely horrific. Then the final bullet there, a lot of people don't think about that. USB sticks. Do people use them in your office? Do they take information out of your office? Where did they go? Do you keep track of them? CDs, DVDs, hard drives. I just told you you need to get rid of all your XP, so you're going to hang up and you're going to go get rid of all your XP. Where do those old computers go? Is there ePHI on them? What happens to the hard drives? Do you just give them to the recycler? Do you smash them? Do you do Department of Defense 7 times wipe to be compliant with DoD standards? What do you do with that before you re-provision a computer, before you dispose of a computer? It's a really big deal, and they want to know what you're doing. Technical controls. Inventory of authorized and unauthorized software. Do you know who can install software on your equipment? What do you have installed? Do you have security risks with what you have installed? We all deal massively in PDF files, Adobe PDFs. We scan things to PDFs and email them. People send PDF documents to us. It's one of the biggest purveyors of viruses there is Adobe PDFs. There's all sorts of patches to that. Java is used for a lot of websites. Adobe Flash is used for a lot of websites. Big security risks. They're constantly being updated. Do you even know what you have installed there to know where you should be updating? That leads to the next bullet, which is maintenance and monitoring. I always say, how do you know what you don't know? How do you know what's going on out there on your equipment? How do you know that somebody tried to install something? How do you know that one of your machines has a virus if the user never told you because you were out at a meeting listening to me today? How do you know what you don't know? How do you ensure all your servers and computers are patched and current? Well, there's ways to do that through remote monitoring and maintenance, where we can basically watch that, see that, focus on the machines that have events, and then not only just say, hey, something happened, but actually intervene and remediate and say, oh, gee, Adobe just came out with an update, a security update. There's 8 machines in your organization that are affected. Let's push that patch out to those 8 computers. We know how to do that. Analysis of security logs. If something bad happens, how would you know? HIPAA is going to want you to do a 6-year look back. All right? We were at a site, medical provider site, about 3 weeks ago, And the person in charge is like, I don't want to know any of this stuff. Well, I can document it. I can tell you who's having login issues. I can tell you where it's coming from. And, you know, HIPAA says that you really kind of need to know that. We had a case a couple weeks ago where we're looking at login failures, and eerily, all the administrative type IDs had massive number of login failures in a month. Just thousands of login failures, especially from the internet. You know, you look at that and say, somebody's trying to do something bad to you. That's it. One more point on the maintenance and monitoring. In the credit card industry, you think Target with what happened to them, they fall under something, not HIPAA, but something called PCI for credit card security. The standard in PCI to deal in credit cards is if a vendor comes out with a security patch, if Microsoft or Adobe or Oracle or somebody comes out with a patch and says, hey, we know that there's a security issue with our software, the PCI standard to handle a credit card is that you are obligated to patch within 30 days. So if Microsoft says it's a thing, you have 30 days to test, evaluate, and implement. And if you don't, then the government would consider you not PCI compliant, meaning that you're really not legit in terms of credit card handling. So that's a different standard, but HIPAA is basically based around that as well. Technical controls, boundary defense. That's a fancy way of saying firewall. You know, you're on the inside, bad guys on the outside, stay away. But it's really evolved past firewall now. It's really about not only bad guys stay away, the NSA, which has kind of fallen out of favor for obvious reasons, but about 2 years ago, the head of the NSA said, you gotta kind of think about security now that the bad guy is sitting next to you in your office, that they're already inside your office. So when you look across your office and look at the cubes, one of those cubes is the bad guy. And you have to design systems, not just to say, you guys stay out and I'm in and life is good, but you have to design systems with the concept that there will be a breach and there'll be the bad guy sitting in your office in mind and adapt to that. And the way you do that is through these next couple bullets: intrusion detection service, IDS, intrusion prevention service, IPS. That's not just keeping the bad guys out. It's looking for the traffic. It's being a traffic cop, and it's inspecting the traffic and looking. And if all of a sudden somebody from inside your office opens up a stream of traffic to India or Kazakhstan, it's like probably a bad thing. And this would step on it and pull the alarm and say, conversely, if all of a sudden you're getting this big stream in from there, it would do the same thing. And just like with antivirus, where you get these signatures to know what viruses are, they have the same thing for these firewall intrusion detection, intrusion prevention. So if somebody, say Cisco, is a good enterprise class firewall, knows that there's these bad folks in Kazakhstan that their data looks like this when they get a hold of you and they see that stream, they're automatically going to be able to identify it and block it. Really, really important not to just have a firewall, but to have these other things. Antivirus, anti-malware, most people understand how to do that sort of thing and why it's important. Those are your endpoints. That's probably where you're going to get infected, if you get infected. And what HIPAA wants to know is continuous vulnerability remediation. What is your process to fix it today, this week, this month, next year? When you find out that you're behind in those Adobe updates, what are you doing about it? How do you go about it? They want you to have that written down. Malware defense. How tightly do you control your endpoints? Do you know if they're turned on? Do you know if their antivirus is current? Do you know that they've run a weekly scan? Do you, if one of them encountered a virus, are you hoping that your end user says something to you, or do you know? We know how to know. We know how to manage that. We'll talk about that in a while. Limitations and controls of network services and ports. There's two types of switches. If you follow your wireless, your workstations back, some closet, someplace, some shelf, you have switches. And all the wires come back to there. And there's two types of switches. There's managed and unmanaged. Unmanaged is what you go to Best Buy and buy, generally. Fast and loose with the rules. They just kind of let stuff flow. Can't tell you anything, can't do anything. Something good happens, great. Something bad happens, oh well. Not much I can do. Managed switches, which is really what you should have and only have in your organization, allows us to look at traffic, allows us to say, well, that stream from India is coming from switch point 4, which is drop A1, which is Sally's desk. We have to get to Sally's desk. We're going to unplug the wire. We could electronically unplug the wire on a managed switch, and then we can isolate Sally, and then we're going to go figure out what the heck is going on. All right? You really want to have managed switches and be able to control that access. Wireless management. I can't tell you how many places I go, and the guest wireless is the internal wireless. So we were at a dental practice, probably 2 months ago, and they just kind of give out the wireless, and all their ePHI, patient management, everything is on the same network as the guests. And again, you don't know if those guys are coming in being infected, and now they're spewing this into your world and potentially getting you infected, or sitting there being able to wander around and read or take patient data. You don't know. It's scary stuff. We want guests to have a great experience sitting in the waiting room, but then we want to keep them the heck away from your critical confidential systems, and if somebody walks in with something bad, that's their problem, not your problem. So it's a huge deal. Administrative controls. We want, HIPAA wants you to have a risk analysis and risk management plans. How do you know what your risks are? How do you intend to manage those risks? Once you identify what your risks are, we have down-level Adobe PDFs, we have Windows XP, we have unmanaged switches, our wireless is messed up that our patients can see the inside of our network. Whatever it is, how are you going to fix it? How are you going to train your staff so that people don't do this again 2 months from now when they forget all these things you just did? All right. Again, huge. Policy set and documentation. Document, document, document. What is your policy for handling ePHI? What is your policy for remediation? What is your policy for maintenance? What is your policy for training new employees? All right. Information system activity review. Where is the ePHI? Where is the electronic protected healthcare information? Is it on your servers? Is it on workstations? Do you put it on USB sticks? Is it on remote laptops and mobile devices? Where is it? Who is assigned to be your security gatekeeper on these HIPAA IT obligations to make sure that you're doing it today, doing it next month, doing it next year? Employee access. Who's allowed to come in contact with ePHI? What happens to their access when they leave you? Do you have change control? If I'm working for you and I say I'm leaving on Friday, do you have a process to cut me off so I don't have remote access, so I don't have access to this data? If I'm working in a job that doesn't require ePHI, and then I change my job with you and it does, and then I change my job with you and it doesn't, do you take me out of access to the ePHI, or do you just kind of forget that and even though my job no longer requires it, I still technically can get at it. When I leave, is my ID gone, or can someone else sign on as me and get access to this? Security incident response and reporting plan. If something bad happens, what are you going to do? What's your process? What's first? What's second? What are you going to do next? Where is this ePHI data located? Is it in your office or offices? Is it in the cloud, in the internet? If it's in the cloud, who owns the data in the cloud? Sometimes there's certain cloud services that you don't actually technically own your own data. You've seen some of that stuff with like AOL and Facebook. You put a picture up there, it's ours, we can use it. So make sure you understand who owns your data. Is it encrypted? If it's left your building in the cloud, is it encrypted? Is there multi-factor authentication to be able to get to it? And by that I mean when I go on to the credit union, I put in my ID, I put in my password, and then it texts me numbers to my phone, and I have to give it the code in a certain amount of time that it texted me. So ID and password is not enough. You've seen these dongles and other things to do that. If you're doing remote access, cloud access, you really want to be doing multi-factor authentication. And then the other big thing are all the vendors that you're using in the cloud or otherwise, who are coming in contact with ePHI, are they HIPAA compliant in their practices, right? So it's not just you're HIPAA compliant. The people you choose to do business with are HIPAA compliant, and if they're using tools that touch your ePHI, then they have to be HIPAA compliant too, and there has to be this chain of custody, so to speak, business associate agreements for people who are touching ePHI, both me to you and me to vendors who are doing things on behalf of you. USB and remote laptops, is it encrypted? You have 60 laptops out there touching ePHI. You have 45 workstations at home where people are doing remote teleworking and medical information. Is it encrypted? Do you have the ability to locate and destroy data on your laptops or mobile devices if it's lost or stolen? And then we get down to the bottom one, which is pretty big, remote access to the office. If you have remote access to the office, you need to be going through a VPN, a virtual private network, and you need to be doing multi-factor authentication. An ID and password does not cut it, and it has to be a VPN connection in some manner, secure VPN connection. Had a little practice. They expose their inside computers directly to the internet for their billing folks. And literally, I could go to the parking lot and I could basically be staring at the sign-on for all their computers. And I liken it to, you wouldn't leave the front door to your building unlocked. You wouldn't leave your office door unlocked and just lock your file cabinet. If I told you, don't set the alarm, don't lock the building door, don't lock your office door, just lock your file cabinet and go home, you would say, you're crazy, I won't do that, that's not safe. But if you're not doing a VPN, a virtual private network connection, and you're not doing a multi-factor authentication scenario, that's what you're doing. You're electronically doing just that. Encryption. If the data is encrypted and you or the vendor doesn't have the key, you don't come in contact with the ePHI. So no ePHI means no business associate agreement. So like if you are encrypting your data and I come in contact with the encrypted data, I have gibberish. I have nothing. I don't need a business associate agreement for that. If I have the key, then technically I could decode it and then I would need a ePHI. But that's it. If it's encrypted, it's gibberish. Encryption is huge. It solves the lost or stolen laptop or device problem for reporting, because encryption, the HIPAA term is safe harbor against loss. So if I lose a laptop or a USB stick that's encrypted, I don't have to report that because it's gibberish. It's a safe harbor. So those 60 laptops that are being used remotely for the field workers going around doing their health services, the 45 desktops at home being used, every shred of data on there should be encrypted. And it's rather easy to do, so that's not necessarily a huge thing. So how do we proceed? We need to develop a plan. Step 1, security risk analysis, using the NIST 8030 as a reference as a good start. Develop a risk management plan to remediate the risks you found from your security risk analysis. Regularly, at least annually, reevaluate your risks, and then take whatever steps you need to eliminate the ePHI risks based on what you have identified. So the no-brainers. If it's ePHI, don't allow it to leave your office ever unencrypted, right? It will never be. If there's a laptop out there, if there's a USB stick out there, it must be encrypted. Document whatever your policies are. Conduct an annual analysis, implement a plan based on that. So switching gears a bit, how can we help you? I won't lie and say we have every bit of HIPAA covered, but we can sure take a huge amount of the compliance burden on the technology side off your plate. Some of the things that we can do is network assessments, basically looking at what's going on with your network. Remote monitoring and maintenance with reporting. The hard drive's dying, Adobe's down level. Here, let's get the Adobe to current and provide reporting to show that you've done your due diligence. Email protection, protecting you from spam, protecting you from viruses, protecting you from outages. Web content filtering, that's not only trapping out pornography and stuff like that, but it's also basically trapping out bad things on the internet that your users might innocently click on that sole purpose is to infect you and do all these damaging things. Mobile device management, enforcing passwords, telling you where they are, blowing them up, locking them as needed. Cloud backup, what happens if your building burns down. Assessment and design, we just talked about that, how to design wireless so it works for you from a services delivery standpoint and provides a good experience for your guests, but keeps the two separate so you don't have to worry about what your guests just drug through your front door. Anti-malware, anti-virus, firewall management, remote access, we just talked about multi-factor, and the true disaster recovery. So let's unpack a couple of these as we close up here. Network assessments. We can independently review the health and status of your network. It can be done one time. It can be done yearly. We can produce reports, including change reports, how it looks different this year to next year, how it looks different after you fix the things we identified to show that you really did it. We provide a visual network diagram of what your network looks like, recent server and workstation health, antivirus, anti-malware, firewall status, Microsoft baseline security analysis. That's essentially Microsoft's best practices for today as to what they think of all your Windows devices today of the assessment. So it's not our opinion, it's Microsoft's opinion of their stuff. Patches, security, passwords. And then we provide a report on all missing and critical updates on the machines, machine by machine. Software inventory of installed software to easily identify, down-level things we talked about. Reports on who has full administrative rights to wander, what folders people have access to, log-on behavior, log-on failure behavior. And then the final one is we do an external vulnerability report where we basically go in and we from the outside, from the internet, go knock on your electronic front door on the internet, and we attempt to talk to you, and we see what your firewall is willing to say to us as a complete and total stranger, having no right to talk to you and no right to see inside of you. And we do that, and we can do that yearly. We can set that up, or even on a more aggressive schedule than that. Our remote monitoring and maintenance Paladin Sentinel services, 24/7, 365 monitoring your network, the health of your network. Your hard drive died, the memory's failing, you're out of memory, you have a capacity problem, your backups didn't run, the internet is slow, you have viruses on Sally's computer, and the scan failed to cure them. We've applied patches to your computers that required security patches, and we can basically provide monthly reports to document what we're working on and what's been done to show compliance. Email defense. We can provide organizations with inbound and outbound email and spam and virus Trojan filtering. So that's not only preventing your users from getting things from people sending them stuff on the way in, it's preventing you from doing something embarrassing and spewing something out because one of your people got infected on the way out. If you've heard the term rate limit and blacklist, where you get on these lists as being known as somebody who's doing bad things via email, this can help that. And just cut down the random things for your users to click on, whose purpose in life is mostly to infect you by just tricking them into clicking on a UPS email or some other thing like that. Disaster recovery. If you have an on-premise mail server like Exchange server, for instance, let's say that thing dies, something bad happens. Disaster recovery option. It'll basically a cloud-based webmail solution. So you can still get at your inbound email and respond and print via webmail until whatever the crisis is installed. Message auditing. You send a message to me. When did it come? Where did it go? We can do that. Archiving. Now the courts have said that email correspondence is a legal business correspondence, and so you get into the legal need to say, well, what is everything you said about this? You know, who did you talk to? Who did you send this to? We can do that as an option as well. Web defense, as I said, it's not just filtering pornography and Facebook, but also perhaps the bigger thing than that, if there is a bigger thing, is being able to just trap out all the known bad sites and bad links, that clicking on them innocently, no malicious intent on your users, their sole purpose is there to attempt to exploit one of these weaknesses in Windows XP or in Adobe or something else to infect you. If we can stop them from even starting, then we have a whole lot less to defend against. So that's a very easy thing to implement. Mobile defense. Monitor mobile devices, smartphones, tablets, laptops. Geo-tracking. Where is it? Making sure you have a password. Being able to lock a user out if they've kind of gone renegade on you. Limiting what they can download. I just read something the other day that 98% of mobile-based malware is on Android devices because they kind of play faster and looser with that platform. And we can kind of say you're not allowed to download. We can say you're not allowed to buy things. We can, you lose your device, we can lock it up. Or you can't find it, we can blow it up for the data. Kind of interesting technology. Cloud backup. Our Paladin Cloud backup is HIPAA compliant, off-site and on-site. It goes to redundant East Coast and West Coast data centers. For disaster recovery purposes, they're on the same power grid as hospitals, emergency providers, police. In terms of if something horrific happened, they're going to be the first to come back. If Boston gets taken out, there's San Francisco area. It's all HIPAA compliant, encrypted, really nice stuff. Wireless assessments, we talked about that, making sure your wireless coverage is correct so you can have wireless where you need it to do your service delivery, but and provide good guest wireless, but keep them separate, keep you safe, keep them away from you. Antivirus, basically managing the antivirus to know that Sally has that issue, to make sure that the antivirus is on, to make sure it's updated, to make sure the weekly scans run. When you get an alert, to be able to intervene to deal with the infection and remediate appropriately. Firewall defense, we talked about there was secure remote access with the VPN and the multi-factor authentication, but also that intrusion protection and intrusion detection, that the stream from your office to India that starts up in the middle of the night, that it will get stepped on in the middle of the night. So it gives you some idea of what some of the things we can help you with. Like I said, we're not attorneys. This isn't legal advice. It's just our thoughts as to what you should be thinking of based on all the information being provided to us in our industry in terms of how these new HIPAA 2013 technology rules affect you and, quite frankly, affect us. But we do believe we have a pretty deep set of tools and services to help you meet this new higher standard for ePHI. And we really love the opportunity to be able to discuss with you how we can help be part of your HIPAA compliance solution. But as I said, I've given you the basic frame with NIST 830, and it all starts document, 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 write it down. What is your policy for each of these things? What are you going to do? How are you going to review? How are you going to remediate? We'd love to be a part of it. We'd love to talk with you further. But at this point, that's the end of my prepared materials. So with that, I'm going to say thank you for giving us your time today. And we look forward to helping you and talking to you in the future. So have a great day, everyone. Bye-bye.